This is April Ross, and we're inside the Beehive. And today, my special guest is Dr. Joy and Dr. George Baker. Hello, you all.
Hey, how are you?
I am great, and I know you guys are great because there's a new business in town, right?
Yes, absolutely.
So tell us about your new venture.
Well, Dad and I were looking for something that we could do together, and it was really kind of more of like a God thing. We were just sort of talking about different things that were going on, and we ran into a gentleman who was telling us about a business that he had in Nashville, Tennessee, that was dealing with people who had diabetes. And so they were using this new infusion to treat diabetes, and they were seeing so much success with it. The guy we were talking to was actually an orthopedic surgeon. And I was thinking to myself, like, why would an orthopedic surgeon be doing diabetes care? And he was showing us these pictures of people who had to have their toes cut off, who had their legs cut off, and how he was able to save people from having their limbs cut off who had diabetes with this infusion. So I started to look into it more. I talked to the person who developed the actual technology to do it. It's really a simple plan. It's just basic science, like we learned about it in probably 7th or 8th grade. But this is an opportunity for us really to have something new for diabetes, which we haven't had in probably 100 years. In terms of insulin therapies for diabetes, we've just kind of been using the same insulins. And so now we have a way of using insulin to treat diabetes with an infusion. So that's kind of what really started us on the path. Mm-hmm. And then we kind of were like, okay, well, what else can we offer? So we just started adding weight loss and Botox and fillers, and Dad's planning to add some teeth whitening. And so we just kind of wanted to have a wellness place. We don't do any primary care or urgent care or anything like that. We just offer what I call health enhancing treatments.
So Dad, when the idea was brought to you, what were your thoughts?
I'm trying to retire.
You thought you were trying to retire.
Yeah, I'm trying to retire, but
okay.
Once Joy came to me and we talked about it, and I said, okay, I'm in. I'm willing to do it. I think, as Joy was saying, this treatment for the diabetes really can change people's lives, and we thought that would be a great treatment to have in the community, so people can understand that they can control their diabetes better. They don't have to lose limbs. So I thought it was a great treatment and a great opportunity to bring something new to the community.
Mm-hmm. Because as we know what diabetes have done to a lot of people, as you mentioned, they've lost limbs. Is that what triggered you to say this is another alternative for people to do?
Yes, absolutely. One of the things that diabetes does is it affects every organ system in the body. And so when we're thinking about diabetes, we have to think about the fact that excess sugar in the blood is clogging up blood vessels everywhere, from the heart to the brain to the kidneys. And so by controlling that sugar, you actually can help save the blood flow to all of these different organs, and especially to your arms and legs and your toes and all of those places. And so when I heard about this new way to treat diabetes, I thought, this will work because it's basic science. We all have a way that our cells take sugar in and actually make energy. And when you have diabetes, that system gets thrown off. And so what we do is we just use regular insulin. We get it from Walmart. And then we have a special patented technology that uses a pump to just give tiny little pulses of insulin. And we change like how far apart the pulses are and how much is included in each pulse, but we basically mimic the way your body used to process sugar before you got diabetes. Mm-hmm. And so that helps the cells to wake back up. It helps clear out the blood vessels. So it can really help if you've already started experiencing nerve damage or kidney damage. It can really help to slow or even reverse that. Mm-hmm. So it's a really exciting opportunity.
So Dad, you got Dr. Baker. So you guys got started. You guys opened when?
We're basically open 4 days a week now, and plans are, if once we can increase our business, we hope to be open more than that. Mm-hmm. But right now we're open 4 days a week, Monday through Thursday.
And we've just been open since October.
Since October.
You know, BTV was at the grand
yes,
opening.
BTV was at the grand opening. We wouldn't miss it. But what kind of results have you seen with the diabetes?
Oh, wow. I know we just talked, Joy and I was just talking the other day. We have one patient who had a A1C, which is the way the way that we determine the blood sugar level in the bloodstream at 14, which is extremely high. Normal is about 6.5.
Wow, that's extremely high.
Right. So
Right, normal is less than 6.5.
We
The
discussed
doctor.
this all the time.
Are you serious? Really?
She
More
said-
like 4 to 5.6
Okay.
is normal.
I say 6.5.
Okay.
But anyway, it went from
Old school
14,
versus new school.
14 to 7.
Okay. Oh. Wow.
Dramatic improvement in her insulin levels. So what does that mean? That means that her body is now processing sugar much more efficiently.
Mm-hmm.
She's able to, change the disease processes in all of her cells, not just necessarily organs, but her cells. So when you think
Wow.
about that, that's a tremendous improvement.
Mm.
She's coming off of some of her medications that she's had to use
Wow.
for diabetes
Uh-huh.
and other medications for other problems that she has, right?
Right. And so we've seen people go from really high A1Cs down to, 7 or 8, which is life changing. And even one of the physicians in the community reached out and was like, how did you do that so quickly? Because this was over a period of about 3 months.
3 months.
3 months, and you have to be consistent with it. So for the first 3 months, you're getting the infusions twice a week. And so this patient was very consistent. She always came, and she had almost given up on trying to control her diabetes because she had been on so many medications. They had tried so many things, and she just couldn't figure out what to eat. And so we just really worked with her, and she was so happy she's so happy with her results, and she says she feels like she's living life again.
Now, Renew is just now with the diabetes. As you mentioned, you guys have been adding different services. Let's talk about the hydration services that you guys offer.
So hydration is critical. We know, most of us don't drink enough water. We don't have the best diets. You know. I'm not even going.
Serious.
Yes, let's be serious. Even I. And so with hydration, we're able to replace the fluids that your body is losing, especially in the heat, because we have really seen a big uptick in hydration therapy during the summer. But it's good all the time. And what I always tell people is that taking a vitamin by mouth sometimes is not as great because only about 20% of it is actually going to get into your bloodstream and work.
Really?
So 80% of what you're buying, even if you're buying the most expensive oral vitamins, is ending up in your toilet, in your urine, and in your stool.
Really?
Yes.
20%?
You're only going to get about 20% activity.
20%.
Yeah. So most of that vitamin is being processed through your stomach, and coming out in your bowel movement or in your urine. With IV hydration, however, we're able to put that hydration right in your veins, so there's no processing through the gut. So we're able now to sort of reverse that. So 80% of what we're giving you in that bag now is active in your bloodstream. And so we have a whole huge menu of IV cocktails for everything from, if you had a little too much to drink the night before, you need a hangover helper. Hangover helper. To folks who are having headaches or nausea, we've got infusions for that. If you just want some energy, or if you are struggling with brain fog, we have infusions for that. We have a hair, skin, and nails infusion. That's my favorite. It's called the Glow Up, and it's got antioxidants and vitamins that really help your hair, skin, and nails. So, we recommend getting an infusion everywhere from 2 weeks, every 2 weeks, every 2 to 4 weeks. We have people that try to come every week, so sometimes we had to put a little hold on them. We're like, okay, yeah, like just hold on, just give us the extra week to let some of that that we've given you already work. But IV hydration is very popular now, and it is a way to replace vitamins, electrolytes, minerals. And for those who are really, really active, like outdoors and doing sports, We also have a peak performance infusion that can help you. You can do it before your event. You can do it after. Alvin went riding for like 60 miles. And when he got back, I said, okay, let's give you a peak performance. And it really helps prevent cramping in the muscles. And so like if you're working out and you're doing all this stuff, you know, there are all kinds of hydration therapies that we can use to help you stay hydrated.
And another thing that this process really makes you think about is, as Joy was saying, taking medications orally, you don't get the full benefit of that medication. But once it's in the bloodstream, it goes directly to the cells. So you're bypassing the process of going to the stomach and breaking it down and then sending it to all the parts of the body. Once it's into bloodstream, it's going directly into the cell. It's at a cellular level. It's going to those parts of every part of the body.
I guess
So it
we
makes
don't
it
never,
more efficient.
yeah,
Never
it makes
think
it more
about it.
efficient.
But
You
but
never
think about it. If you go to the hospital, right,
Right.
and you are in really bad pain, how do they give you pain
They're
medicine?
gonna start looking for their vein.
Right, they put it in the IV.
That's right.
If you are needing antibiotics and you really need the antibiotics to get to where they're trying to go and heal infection, where do they give it to you? In your IV.
They do.
Because they know that when we process through our stomachs, we actually lose a good bit of the effectiveness of that medication. So when you're trying to get really well hydrated, IV.
Now let me ask you this for the athletes, because I know that at what age do you all recommend?
So a parent can consent for their athlete if they're under the age of 18, but I usually recommend 14 and up for that. Now, if there are, kids that are under 18 who have special needs that they need additional hydration, then we can certainly talk about that, but we would definitely want the parental advice. And we would, we have a family physician that we would consult with and make sure that we have the right dose for kids.
For kids.
Because they really need to be at an adult body weight
Okay.
to get, so,
To
at
make
least
sure.
90 pounds. Yeah.
So now we talked about the IV hydration, and we know that there is another service that kind of get rid of these little lines and stuff. Is that right?
That's right.
Something that has been around for a while, but in this area, to me, I just hear more about the Botox, right?
Yeah, yeah.
But we've heard about it for a while, but it's just, kind of, especially with us, it's kind of like taboo, but I've been knowing some people been getting some.
Oh, lots of people get it. And, I think that people kind of want to stay private about it because they want people to think that they just woke up like this. But I say it all the time that whatever you can do to enhance yourself that you are interested in, I think you should try it. I love Botox. I'm going to always have some Botox because it really does help prevent wrinkles because we make wrinkles when we move our face. Right. And, over time, as you move those muscles over and over again, it will create a wrinkle that will not go away. And so even when your face is still, that wrinkle is still trying to hang out there. So for me, as a woman of a certain age in my 40s, I refuse to go down without a fight. So I'm going to have me a little assistance so I can make sure that I stay. And it was so funny. It was actually Dad that convinced me to do Botox.
Dad?
Yeah, because
you did? Look at it. Wait a minute. How did you do that, Dad?
So,
what did you say?
Well, we were working on some patients, and I looked at Joy. I said, Joy, you ever looked at your forehead?
This guy.
She said, no, I don't need to use that. I said, well, look in the mirror. And she did.
Because you know what I said? I said black don't crack.
Right.
And then I went and got in the mirror, and I was like, I started moving my eyebrows up, and this whole thing looked like an accordion, it was like, and I was like, oh, wow. I really do have some wrinkles. And then, I made a little angry face, and those little lines in between your eyebrows came up, and I was like, oh, no. So I went ahead and let Dad give me some Botox that very day.
So, Dad, you did it?
I did it.
Mm-hmm.
Now she does her own.
Now she does her own. Won't let you touch it.
No, he could touch it. Usually I'm doing it myself, like when I'm busy and I'm like, okay, let me just put, But yeah, it's been a great add to our practice, I think, because people really do love it. And given that we are both surgeons, like, Dad actually did oral surgery at the hospital for
30 years.
30 years.
30 years.
hmm And I am still very active in doing surgery, and so the anatomy part of it really was what got us very interested in, like, going to these courses and learning about it. I actually got to go to a course where we dissected a whole face.
Oh, wow.
And so we learned every muscle, the nerves, we learned where all the blood vessels were. In our practice, we do have a handheld ultrasound, so we're actually able to avoid some of the complications that you can get from fillers. Using dermal fillers in the face, sometimes you can compress those blood vessels and cause some pretty bad looking stuff to happen to people's skin. So we always want to be safe, and so we're all about anatomy, safety, and technique. And we want our clients to really be satisfied and to look natural. I don't really like people to look overdone.
Right, right. Would you ever get to a point and say that's enough to a client?
We do. We
Oh,
have.
really?
Yeah.
You have. You say you have.
We have. We have told some folks, hey, I think that's enough for right now. Let's come
How
back
did
in
they
a few
take
months.
that?
You know what? I think they took it well, because I always kind of explain it like, we really want you to have the best results. And there's only so much filler and so much Botox that you can use before you start looking not cute. My motto with my clients is cute, not crazy.
Right.
Cute, not crazy.
Not crazy. We're not trying to look crazy, because really I don't want you going around telling people, oh yeah, she did, and you look crazy. So
And they gonna say, Dr. Baker, you did.
yes, and I'm like, no,
We don't want
we
that,
don't
do
want
we don't want that. So yeah, they take it, and I just always say we want to be safe first, and we want you to have a good aesthetic outcome. We don't want,
So how do they take it when you have to tell them that's enough for right now?
They usually are okay with it.
But
They'll
you're
say,
giving them the best advice.
the next thing they say is, well, when can I come back and get some more?
Right.
Maybe
so-
want it.
Yeah, oh, it's very popular, especially in our younger population. Lip filler, they love it.
I was there with Dr. Joy when she did a lip filler, and the young lady, it started to transform before my eyes. It's just that quick,
Yes.
and she was just so happy. She was just doing the pouty lip and everything.
Right.
So do you give them a consultation before?
Yes. We are really interested in comprehensive facial aesthetics, which basically means making a plan for the whole face, so that you can be able to kind of work through that plan. So we wouldn't do everything in one day. The goal is to, like, just sort of gradually transform the face and to add volume, because as we get older, we lose our volume in our cheeks, under our eyes, and it can start to make the eyes look sunken. It can make the cheeks look really flat. You kind of start to lose the fat pads under the cheek, and you start to lose bone as well as you get older, like on the angle of the jaw. So what we're trying to do is basically reverse that aging process slowly but surely to get you back to where you have a more youthful appearance.
So Dad, what is your ultimate goal, your personal goal with Renew Infusion
Well,
and Wellness?
For me, having practiced dentistry for 35 years, Renew is just a way to take a lot of the training that I've had and put it into a new concept that allows us to keep people more youthful looking and just more healthy. As far as the diabetes treatment, it just to help people to be more healthy and to be more youthful in their appearance.
Now you plan on going a step further with the dentistry part, is that right?
Right. We plan at coming up. We plan to get into some tooth whitening, that kind of thing. Maybe even some cosmetic dentistry for patients. But right now, we've kind of focused in on the treatments for diabetes and the cosmetic stuff that we're doing right now.
Now, Joy, I hear the wellness part of Renew. Let's talk about that.
So Renew's partnered with Inara Health and Wellness, and Inara Health and Wellness is owned by Latalia Lewis and Elizabeth Stargell, and they're our partners because they offer a whole lot of wellness coaching. So if you don't really understand what's going on with your blood pressure or with your diabetes or just with your overall health issues, they offer health coaching. It's in the form of what's called functional medicine. And functional medicine is basically kind of taking a more holistic approach to medication. And so kind of trying to understand the underlying cause of the disease and then how you treat it. So helping you understand your medications, also helping you understand the 4 pillars of health. The 4 pillars of health are what we eat, how much we move, our activity level, our sleep, and our stress. And so they really kind of coach people on how to manage all of those things so that you can be at your healthiest. We don't really, in traditional medicine, which I'm a traditionally trained physician, I believe in medication, but I also believe that sometimes we can change disease process by just living a healthier lifestyle. And that's been proven, and we all know that. But managing our sleep, our stress, our activity level, and what we're eating, we can actually kind of revitalize our bodies that way. There's a saying that's called pill, forever ill. You can keep taking pills, you can keep getting prescriptions, or you can start changing your diet, you can start changing your activity your activity level, you can start making sure you're getting 6 to 8 hours of sleep per night. And that doesn't mean that would alleviate all the needs for all medications, but you can really diminish your need for medication just by taking better care of yourself, staying better hydrated. And so our partnership with Inara Health and Wellness through that functional medicine program, people can get diet coaching, they can get hormone coaching, they can do detailed hormone panels with them called a Dutch test that can help, to find out what's deficient in your body and how you need to work to change that. So I think it's a really cool thing. And like I said, we don't do like primary care. Like you can't come see us for a cold or the flu or anything like that. Although we do have an immunity hydration that you that helps boost your immune system.
Oh my gosh,
but
I need that.
what we want to do is sort of fill in some of the gaps that traditional medicine has. So some of those things, and for me, women's health is my passion, and I believe that aesthetics fits with women's health. Because you'd be surprised how many women walk around with a lot of insecurities about their appearance. Especially as they're aging. And so I see that as just another thing that we need for our overall whole health. Yeah, so we do that. But I feel like we have a good mix of treatments with our partnership with Inara, with our aesthetics, with our diabetes care. And then, of course, we have weight loss, too.
Let's talk about I know, I was too. Let's talk about the weight loss part of it.
Well, weight loss is another area where we've tried to bring something a little bit different into the realm of treatment for patients. And with Inara working with us, they also help us to kind of identify those patients that could really benefit from that type of treatment. And also, they can help us with maybe medications that might be used, right, Joy?
So we have a partnership with a compounding pharmacy that does semaglutide and tirzepatide. And with compounding, it just means the medication is made directly for you. Now, one thing you have to be really careful about, because I see a lot of like online companies who you can like just sign up and you get a virtual visit with somebody. Well, you want to make sure your compounding pharmacy is reputable. So I spent about 3 months really digging through compounding pharmacies that follow FDA guidelines, because compounding medications are not necessarily approved by the FDA, but I looked for companies that actually have the same standards that FDA companies require. So we were able to get that so that we could make sure that we have a high quality product for those people who may not have insurance coverage for some of the weight loss meds like tirzepatide or semaglutide.
So when people come to you, do you all set a goal or let them set a goal of what they want to, at the end result, want to be as far as weight loss is concerned?
Yes, absolutely. So when you come in, you get a full physical exam.
Okay.
And we're going
Full
to
panel of tests.
full panel of tests,
panel of
labs.
tests.
Prior
Yes.
to starting the treatment.
Okay.
So this is not some little online sign up thing. You're
But I
gonna come
could just
in.
and say, I just want to do this.
No, you're
Not
gonna
that.
get because we are concerned about your overall health. So if you're not a good candidate for these medications, we want to know that, and we want to guide you in a different path. So you're going to get labs, you're going to get a full a physical exam, a medical history. We need to look at all the medications you're already taking, and then we decide whether or not you're appropriate for these weight loss meds. And so we have plans for weight loss as low as $250 a month. Whereas if you try to buy these drugs from the drugstore, you would probably spend about $1,000 a month. So yeah, so our semaglutide is $250, and then we have tirzepatide, which is similar to Mounjaro, that is $389 a month. So it's a really great deal if you're somebody who's been trying to get meds and you are spending $800 or $900 a month. We could definitely reduce that price for you if you don't have insurance coverage, which unfortunately many insurances don't cover weight loss.
Do you all couple that with exercise?
Yes. So yeah, we have. So you'll receive some coaching, and every follow-up, we actually do a food diary. We want to know, like, what did you eat for the last 24 hours, so we can kind of get an idea.
Ask me that right now.
You know, I'm sitting here thinking about what am I gonna eat right now, because I haven't eaten yet today. I'm like, oh, what am I gonna eat? But yes, and we really offer a lot of coaching, and we also talk about sleep and stress with your weight loss, and then we talk about how we want the waist circumference to be. The waist circumference is actually the biggest predictor of your cardiovascular risk. So if we can get women with their waist under 35 inches and men with their waist under 40 inches, we set a goal to do that. So every month you come in for a follow-up, and we're following your progress and measuring your waistline. We're measuring your body fat composition and your weight. Yeah. So we don't play around. We're robust.
Giving everybody what they need,
right?
And what they desire. Okay. So again, let's just rattle off the services that renew and where you guys are located, and how do they make an appointment?
So you can call 706-407-6970 to make an appointment, or you can go to our website at www.renewinfusionandwellness.com, and you can fill out your health history online and request an appointment right there online, and we can get you in. And we have a fabulous staff. We're staffed by nurse practitioners and registered nurses, so we don't have any. You know, everyone that works with us is licensed, so it's a licensed professional. And so we are located at 1605 Vernon Road, Suite 1600, and that's right close to the buffet. So we hope to get patients from the buffet, right close to the buffet from the country buffet. So y'all come on down after you finish eating. We'll help you lose some weight. Get your grease. That's his favorite thing. He likes to walk down there and get chicken on the days we work. So, so we're right there in the medical plaza at Leeds Crossing, and we are offering a variety of services, from comprehensive facial aesthetics to cutting edge diabetes care, weight loss, health coaching, hormone testing and treatment. So come and see us.
All right. Well, we thank you guys for coming on. They're building a better you with the bakers. I like that.
Yeah.
I just thought about that.
Yes.
Building a better you with the bakers.
I'm about to put that on the website.
Yeah, that's going on the website.
They're going on
the
website.
Yeah.
I thought about that. Because that's what you guys are doing.
And that is the plan. And there's no referral necessary to come for any of our services, but we love to work with your primary care physician if they would like to refer you, so they can also keep up with what you're doing and make sure that you are progressing well.
This is April Ross. We're inside the Beehive.